My hands layered one over the other. Take a deep breath in. Let it all the way out nice and easy. And as he's kind of doing that in small circles, I'll try to get deeper. And I might do this process over 2 or 3 breaths. Take another deep little breath in and let it out nice and easy. And I'll just keep working my way down. And what I'm looking for to feel out those fibers really deep down below the abdominals. It's deep in there. You have to really press down. Now, to double check that, what I'm going to ask you to do, can you lift your left foot just about 1 inch off the table, and I'll feel those fibers flex up right in front of you. You can relax. Okay. If I'm too medial, I may start feeling the pulsations of the aorta. If you're on it and it's pulsating, you don't want to be on it. Get off of it. It'll be just the psoas is just lateral to the aorta, and then eventually the branch of the what's that? Where it splits? What's it called? Iliac artery. What's that? No, the artery. What's the artery after it splits? Common iliac?
Isn't it?
Is that it?
I think I do not remember.
So muscles don't pulsate like a radial pulse. So if
I'm not even going to put any effort into thinking about it.
You just kind of take your fingers off and move on. The iliacus itself, the way I assess that is I'll find the patient's ASIS and I run right along the edge of the pelvis itself, down and in. A little painful there. And I can get an assessment if it's guarded. Once again, to make sure I'm on it, just lift your leg up a little bit. Yeah, and then relax. It doesn't have to lift high. To get it better, what I can have you do is just bring your leg up higher there and then rest it down. So I can put it on more tissue slack. You have a history of issues here? Have you ever had?
Is Nick making faces at the camera?
No. Yes. Yeah, you've had inguinal hernias before. People are very guarded and do not like to be touched in that region, especially with a history of inguinal hernias. Because I'm one of them.
Stacey, can you see over there? Maybe I should come over there.
So that's psoas, iliacus.
Oh yeah, this is much better.
Have you guys learned the muscle length test for iliacus and psoas?
At some point, we
I'm
did.
sure we did. But
How did you do it? Prone.
Or sidelining, actually.
Sideline or prone? And then you
She doesn't.
the iliac versus psoas length test.
for sure sidelining.
Muscle length test. Lay on your stomach real quick. The iliacus is a one-joint muscle.
Well, Ryan was
Guys,
making
heads up. Come on.
animal
I'm just gonna
noises
do it quick.
earlier.
You guys gotta practice. Don't argue if you did it yet. The iliacus is a one-joint muscle. So as I'm extending the hip, if it's short, the pelvis is going to anteriorly rotate as I'm extending this hip. The psoas is a two-joint or multi-joint level because it attaches to the lumbar spine. So what I do is I place my hand so that the pad of my hand's on is PSIS, so get an assessment of the pelvic motion, and then my other fingers are on the lumbar spine itself. And what I'm going to do is I'm just going to passively extend his hip, and I'm going to assess to see which one moves first. Now I should be able to get a full 15 degrees of extension before either move, because that's the normal range of motion for hip extension. If I'm lifting him, and the first thing that moves is the PSIS under my hand, I might suspect that the iliacus is short. And then as I continue to go, if the psoas, if the lumbar spine extends, I might think the psoas. If I'm lifting the leg and the lumbar spine seems to extend before the PSIS moves, then I'm suspecting the psoas is the short muscle. The only other factor, or some other factor with hip extension, if it's tight and the pelvis moving, could be a tight anterior capsule. So if I'm suspecting the iliacus, I might want to assess the anterior capsule of the hip just to rule that out. Or what I would do is just palpate the muscle to see if it's engarded. He's very tense and tight when I'm on it. You guys saw him jumping. He's really tense and tight. So that's something you guys should know, and that could be something that I test you on because I just showed it to you right there. Show me the muscle length test for the iliacus and going through that thought process.
Muscle length test for the iliacus. Oh, then the PSIS under your hand will move first. Yeah. Then it's going to be psoas.
I try to be careful of is I try to keep a good amount of knee extension. So that way, as I'm extending the hip, it shouldn't be a rectus tightness here. It could be a rectus. Now, if I have them all the way up here like this, I'm like, okay, I'm gonna lift your leg up, then it could be a rectus, and then I'll be pulling that. That would give me a false reading. So that, yeah, that's a good question. So the thing you change is the knee position. You want that extended. Okay? So why don't we break up and do all of those?